and thank you for joining today's webinar, Step Up and Lead, Guiding Your Organization Through Crisis. So over the next 30 minutes, Polly and I will share best practices, guidance, and some frameworks to help you lead your organizations and teams during this unprecedented time. We will cover some high-level principles on leadership, and then we will drill down, show you how to apply best practices, and take you through our crisis leadership framework. This is a time like no other. And while you've most certainly dealt with unexpected incidents and challenging issues or crises on the job before, this time is different. There's an agreement among leaders at organizations of all types and sizes right now that one, there is no definitive playbook for this, and two, we're all in this together. Organizations, big, small, public and private, are all dealing with the uncertainty and unexpected challenges of this pandemic. And you'll see as we review some insights on leadership during difficult times that leadership doesn't require wearing a cape or tremendous strength. It's about remarkable humanness and an acute awareness of the needs of people. Compassion is what people want from leaders now more than ever. Scholars and experts who study the characteristics and skills demonstrated by high-profile leaders often uncover these broadly relevant lessons that we all can learn from. Author and presidential scholar Doris Kearns Goodwin has studied some of our most well-known presidents, and lately she has offered her insights on leadership for this moment in time. And I bring up her work not because you are expected to lead a nation of people or show the bravery of our country's great wartime presidents, but because there are some common traits that remarkable leaders demonstrate during difficult times. This list by Kearns Goodwin in her book, Leadership in Turbulent Times, is very relatable and relevant today, even though it reflects leadership traits of Abraham Lincoln. And contrary to the popular belief that leaders are born, leadership is cultivated and it can be learned. For the purposes of our discussion, I've distilled Kearns Goodwin's list on Lincoln into 4 characteristics or key tenets of good leadership during a crisis. Trust. And while trust is generally built over time, in a crisis, good leaders instill trust in their handling of the moment. They provide assurance and show conviction through their commitment, credibility, and responsibility. Transparency. Good leadership is marked with certainty and candor. Accuracy and clarity are reflected in the words of strong leaders. They are unambiguous, even when they do not have all the answers. If they don't know something, they say so. Empathy. Their actions and words are responsive to the needs of people and show compassion, understanding, and insight. If there was ever a time to put yourself in the shoes of someone else, this is it. We'll talk about stakeholder engagement later on to help you navigate this important leadership skill. And finally, leadership requires adaptability. Adaptive leadership has become a buzzword lately, and it simply means this. You are adapting to a challenging environment and effectively responding to new and reoccurring situations with open-mindedness and creativity. Adaptability is vital to successful leadership and successful outcomes. The path ahead is filled with many unknown twists, turns, and probably a few detours. You cannot wait for perfection or for all the answers to line up, especially now while the science of COVID-19 evolves. Researchers try to end the pandemic, and government and industry leaders attempt to keep people safe and find a path forward. There is much uncertainty. You need to lead through it, not around it. This is also a time to reconnect with what guides your organization, your purpose, your mission. Whatever your organization calls it, it is the true north that must guide your organization now more than ever. It should be the moral compass, as author and leadership expert Eric McNulty says, to navigate the COVID-19 crisis and guide decision-making at all levels within your organization. And once your clarity of purpose is reaffirmed and articulated, you've put a symbolic stake in the ground for everyone within your organization to rally around. And this brings about alignment. Alignment that every action, every decision during this crisis must tie back to a larger purpose. When people understand that their work in a crisis serves a greater purpose, it becomes easier for them to actualize the need, to carry out what must be done, and to execute their responsibilities with a heightened awareness and sensitivity to their stakeholders. And when your teams are armed with that type of guidance, that understanding of your organization's true north, achieving a common goal during this uncertain and unprecedented time is attainable. Leadership and management go hand in hand, and I'm sure you've probably wrestled with the differences at times, but they're not the same. The distinction is especially important in times of crisis, even if you feel like you're wearing both hats on some days. The manager's role is to organize and coordinate, keep the trains on the tracks and keep them running on time. The leader's job is to inspire and motivate. The leader is the light in the darkness. And while the manager's priorities are grounded in the here and now, the leader is always thinking about the future. So right now, nearly everyone within your organization, whether they're leaders, managers, just anyone tasked with helping respond to this pandemic, probably needs to unlearn some instinctive behaviors that are working against them in this crisis. Stop waiting for information. The answers are not always there, or they will change tomorrow. You need to act with urgency. Demonstrate you are in command of where things stand at this moment in time. Admit when you don't have the answers and provide updates as soon as the information becomes available. Downplaying the threat and withholding bad news, this is a common pitfall and often done out of a misunderstanding of how people receive and understand information, especially bad news. Studies have been done on this. People want to hear the bad news, and they want to hear it right away because it reduces their worry. So communicate often and with full transparency. Doubling down to explain your action more clearly. Mistakes are going to happen. Acknowledge failures or missteps, and then show that you are committed to the changes necessary to correct any problems. And finally, staying the course. This coronavirus has turned this old habits on its head. Everything is looked at with fresh eyes, practically every day, and constant updating with your stakeholders is the new norm. As we discuss some of the more practical applications of leadership designed to help your organization, we're going to try and answer a question that is probably top of mind for you, and that is how. How do I actually do this difficult job of leading through COVID-19? Polly and I typically spend a good portion of our time with clients helping them build effective response teams or networks of teams. We learn about organizations' operations, their unique team structures. We even drill down into the type of IT resources that are available to keep teams connected. But at the end of the day, our clients are the experts on their organizations, their people, and their respective industries, the same as you are. And since we cannot know exactly how each of your organizations is built to provide you with a customized response team guidance, we can share some best practices. McKinsey recently shared these 4 steps to creating a network of teams in response to the COVID-19 pandemic. And we think they're broadly relevant and straightforward enough that you can put them into practice. Now, South Dakota on whole has had some time to ramp up and prepare for COVID-19. Many of you probably already have response teams in place. These best practices are easily embedded and adopted by existing teams if that is the case. But first, you need to launch fast and build as you go. Teams must be nimble and built to learn. They can retool or form subgroups as needed. Most important, they must be empowered to respond to the fluidity and dynamics of a pandemic situation. Get out of the way, but stay connected. This is important for leaders, and it's probably obvious what this means. It means don't micromanage, but that doesn't mean hands off. There are some key functions a leader must play, and that is 1, ensuring multi-directional communication across your organization. 2, become the catalyst who identifies opportunities, makes connections, sparks ideas, and secures resources. And 3, be a coach. And that means staying connected with team leaders and members to help them manage through any challenges they might face. Champion transparency and authenticity. You're going to hear us say that a lot during this webinar. Teams thrive when there is mutual trust and collaboration. They need to show curiosity, question norms, and take risks to succeed, and doing so requires a culture where people feel safe and confident. Finally, turbocharge self-organization. As a crisis evolves, so will response teams. And as a leader, your role will evolve too. You will be the one who recognizes the changes and the change makers that will emerge during this time and will play a vital role in the new normal. So I'm going to hand it over to Polly now, who's going to take us through some steps to put this leadership into action.
Thank you, Mary Ann, and good afternoon to everybody. We know that all of you are hungry for ideas and advice you can apply right away to the challenges that you're facing. And with that in mind, what I'd like to do is build on the best practices that Mary Ann just outlined and provide some specific ways you can apply these day to day. And I want to mention up front before we move into this, Mary Ann and I have some experience and insight into healthcare, but our main area of expertise is related to crisis response and crisis response teams. So we want you to listen to what we're saying, and if you have some follow-up questions that are specific to your industry, we'll try our best to answer those. So what are the habits of highly effective leaders? When Mary Ann and I, we spend a lot of time working with and observing companies that are going through crisis situations. And we've noticed that there are certain things that are always present in the leaders of those organizations when the organization is being successful in responding. They're taking care of victims, they're reducing scandals that may come out of the situation, they're dealing with the core issue and addressing it, they're protecting people. So when they're being successful, these are some of the things they see. First of all, good leaders, they show up and they're present. So if you are showing up and being present as a leader, that means that people see you there. You're either going to a site where there might have been a fire, you're stopping by to talk to an employee who may have faced a specific challenge that day. You're visible and present on Zoom calls and response team meetings. The second habit is communication, and communicating a lot. Communicate, communicate, communicate. In a crisis, everything you do will be interpreted. And you need to be there communicating about why changes are being made, what you're doing, making sure people understand what they need to know. And you're going to have to repeat those messages often, because when people are stressed, their ability to comprehend and maintain ideas in their heads decreases. We'll talk more about that on the webinar that we're presenting next week on communication. Leaders who are effective are also modeling and reinforcing desired behaviors. An example of this was recently when the governor of Minnesota self-quarantined for 14 days after an exposure, and also wore a mask and has continued to wear a mask in press conferences. Leaders have to walk the walk as well as talk the talk. You have to do the things that you're telling other people to do. The fourth habit of an effective crisis leader is this ability to maintain multiple planning points of view, and sometimes that's all at once, and it's also being able to shift between those modes very quickly. So for example, thinking about the short-term continuity of your business at the same time you're thinking about long-term. Thinking about what's happening as your facility while at the same time keeping an eye on what's going on in your community and your region. and simultaneously keeping an eye on people, on operations and finances. So being able to mentally shift between all those things makes you a more effective leader and takes you out of that manager zone that Mary Ann spoke to. Effective crisis leaders are very aware of and very careful to set aside internal politics and personal decisions, personal differences. And I hate to say it, but sometimes our worst traits are at their most pronounced when we're under stress and in a crisis situation. So as a leader, you need to be staying out of those traps yourself and helping other people navigate internal politics and personal differences. Effective leaders also are constantly reevaluating and assessing on the fly. And that can be as simple as, if you're the head of a nursing department, at the end of the day, checking in with your nurses and saying, what did we learn today? What kinds of things that came up that we didn't expect that we need to prepare for tomorrow? Dr. Stephen Corwin, who's the president of a New York Presbyterian, was on a webinar yesterday, and one of the things that he said that struck me is he said, if you're in a leadership position and you're not doing some soul searching, if you're not thinking about what you did, what could work better, then you're making a big mistake. So this is one of the things that allows you to be more adaptable as a leader, is continuing to ask those questions and even building in time into your response team meetings to ask the question, what do we need to do differently? What have we learned? What do we need to be thinking about next? And the last piece of this, as again, we've said a couple of times and you'll continue to hear us say, you've got to be adaptive, you've got to be innovative, and you've got to be transparent. And when we talk about transparent, it doesn't mean telling everybody every single thing that's going on in the situation, but it's making sure they understand the process, that there's nothing hidden from them, that they understand what the organization is doing and where it's going. Let's focus on communication for just a few minutes. If there's anything that you take away regarding communication, I want it to be this: focus on we and reiterate why. So here's 5 things related to communication, and I'll talk a little bit more about the we and the why as part of that. One of the first things you need to do is to set expectations for when, how, and how often staff or other audiences that you're communicating with will hear from you. In the case of New York Presbyterian, that organization was set up during the COVID-19 response, where they had a response team meeting at 8 o'clock every day and 4 p.m. every day. And at 10 a.m. following the first meeting, they would hold a WebEx for all the employees to participate in so they could hear what they needed to know. And employees came to count on those presentations, and I could actually archive old presentations. That's the kind of thing that you need to do. Consistency is important. The second piece, as I said earlier, is to focus on we. That means demonstrating empathy and concern for staff and everybody's well-being. My experience was this: I live in South Carolina, and when one of the first press conferences happened around COVID-19, all of the presenters for the state government spoke about the public. They talked about the health and safety of the public. They talked about protecting the public. And as a communicator, I probably noticed this more, but I think I would have felt more confident and comfortable if they had been saying we. We as a state are going to get through this together. We are taking measures to do these things. Here's how we'll all work together to survive this successfully. So think about using we and engaging people in your process and your thinking as often as possible. 3, can't emphasize this enough: deliver clear messages about the current situation. Most of your presentations to people, conversations with people, should start with a clear explanation of where we are right now today. Number 4 is the follow-up to that. Speaking to your principles and your procedures. What are the things that your organization is doing? If you don't have all the answers about a particular thing at that given moment, what are the processes that you're following to make sure that you're adaptable, that you can respond, that you can get the information you need? And reiterate your why. And when we talk about your why, that in most cases are the guiding principles of your organizations or the guiding principles that your response team has set for your response. And the 5th piece of this is to, in all your communications, continue to acknowledge that the situation is fluid and that you'll continue to adapt. People need to be prepared that things will change based on new information and new developments. That's true in most crisis situations, and it is so true in this one. So you need to constantly prepare people that things may change, and what you say today, or the policy that you set today may need to be different tomorrow. Mary Ann talked about crisis teams. Again, this is one of those topics where we could spend hours talking about it, and we also need to understand each of your organizations a little better to give you advice. But I wanted to offer you two models to think about in terms of a crisis team. If you're a small organization, if you're a single facility or a department or a single team, you might want to think about using the task force model, and that's where you have a core group of 3 to 4 people, and those people should have some accountability and authority within your organization. A small group of people that comes together and manages multiple aspects of the response and then pushes out information and the policy to others in the organization or the location. If you are a larger health system, a large hospital, any kind of multi-department or multi-facility entity, you probably want to use something that's like the incident command, or what I call a response command model. And that's where you have a very senior person who is overseeing all aspects of the response. Department heads report into that person, as well as people who are assigned specific response leadership functions within the organization. And then there are smaller sub-teams that report up through those. We'll be happy to answer some more questions about crisis team in the Q&A that follows. The last thing I want to do is walk you through a crisis leadership framework that we have put together. So as a leader of a crisis, how do you organize your thinking, your team, and their activities? So this is a very simple leadership framework that you can use to stay organized and on track. It comprises 6 specific factors or functions. The first is situational awareness. We also have prevention, issue and incident management, stakeholder engagement, business continuity, and then last but certainly not least is team care. So I want to talk first about situational awareness, and here's the challenge of this. Every day as a leader, you have to ensure that you are addressing the situation as it is now, not as it was a week ago, not as you wish it were. And this means that you really have to know your facts. You've got to have a good handle on what's going on today. So we call this situational awareness. So right now, what I would suggest you do is you think about moving into a period where you may have COVID cases or COVID more widely across the state of South Dakota, is to take some time to plan out how you were going to manage information and make sure you have the most current information. The first piece of this is to determine what are your critical information categories. What are the things that you at your facility or in your department across your organization really need to track? This is information that you as a leader will need to make better decisions and more accurate decisions as you move ahead. Identify external and internal information sources. What are your go-to authorities that will provide the information you need, whether that is an organization like the CDC and specific pages or on their website, your trade industry organizations, or even within your facility, who has the information you need, such as what is our current stock of PPE. The next piece to think about is how you package that information and share it with people within your organization. We sometimes call this maintaining a common operating picture. You want everybody having this, as much as possible, having the same information in front of them so they can make decisions autonomously. And that can be done through a dashboard. A dashboard could be as simple as an Excel spreadsheet that has all the current information, or some sort of email summary that's updated daily. And finally, if you have the bandwidth to do it, it makes a lot of sense to assign one member of your staff or a small team to maintain situational awareness for your organization. They can pull all this information and package it for you. What does that look like? We put together a sample dashboard just to give you a visual of what we're talking about here. For example, you might want to have something where you're tracking on the global and national side all the federal actions and directives, any updates coming out of WHO or CDC. You might want to be having something from the state and city level. Again, what are the state actions and directives? What are the case counts in the counties where you do business and are closest to you? Any municipal decrees that may have an impact on your work. Then specifically, What do you need to keep track of regarding your company and facility? Number of cases, staff health, patient health, PPE supply, and then any current issues and incidents. And finally, have some place where you can store and provide easy access to all your current response plan, any kind of information related to patient care, PPE use, staff benefits leave, any current policies that people need to access. You don't want to have people digging through emails to find these things in a crisis situation. Prevention is another piece of this framework. I'm not going to spend a lot of time on this today because the guidelines for prevention are fairly well laid out by CDC and others. But the key point here is that you need to have a team of people who are focused on preventing and mitigating impacts of COVID-19 in your facilities. And that should be a very focused and staffed function of your response team. So let's talk about issue and incident management. Within the context of COVID-19, there's going to be things that come up every day that you have to deal with. And now, again, you have an opportunity to kind of plan and think through these in advance. So what we recommend is that you do an exercise where you work through these 4 questions. What specific issues and incidents might occur? What do we want staff to do right away to address these situations? What situations do staff need to report? To whom do they report them? And how and when? How soon do they report them? And how will we follow up or monitor? And this is an important piece, right? How do we continue to follow up on something that happened to make sure we have all information, that it's taken care of, or if there's additional steps that we need to take care of that situation? We put together an example of scenario-based planning, and we framed this up as a long-term care facility, but we wanted you to see what we mean by figuring out what your potential situations are. And a lot of the work we do will help companies put together a list of scenarios. And usually we try to come up with some variety among these scenarios. They're all things that we think could happen. They're all high likelihood, potentially high impact. But we try to keep them very diverse so companies have a chance to think through different aspects of their operations. So for example, in this one, 3 scenarios. The first one is a resident diagnosed with COVID-19 based on symptoms. Maybe it's the first case in your facility. Your team should sit down and think through that. What do we do first? What do we do next? How do we want people to report it? How do we follow up? Another scenario might be that you find out a vendor who's recently been on site has been quarantined. What are the implications for your organization? What do you do? What do you want your policies and procedures to be? And the third one might be something like your facility organization has become the focus of media scrutiny. So how do you handle that? And also, how do you want employees to handle contact from media? Who do you want them to refer those people to? So again, we just offer this as an example of the types of scenarios you can think through. Stakeholder engagement, we recommend a process that we call COMPASS, and that's simply where you classify, characterize your stakeholder groups, you outline their needs, and you identify people who are the best liaisons with those groups. You set up messages and channels that align with what works for those stakeholders. And then you actively communicate with those groups. You put those processes into action. You're constantly accommodating them because people's information needs change over time. And we also recommend that with all your stakeholder groups, you reach out to them and get feedback from them. Are we communicating in the right way? Do you have unanswered questions? And then the last piece of this, as you start to think about where your business is going to go for here, you need to start preparing those stakeholder groups for the new reality of your services or how you might interact with them. Again, we put together an example of a stakeholder map. I am going to go through this very quickly because I know we're running up toward the end of our time, but the idea here is that, as you can see on the left-hand column, you list out all your stakeholder groups, and then you ask yourself the question, what do we need them to know? What are the most important things that we want to make sure they understand? Then you put yourself in their shoes. What will they want to know from us? Then you also think about, what are our overarching messages? What are the key things that they need to take away from their interaction with us? And then the last part is thinking about how we communicate. And you'll see an example here about staff, and I think everybody received a copy of the presentation so you can look through that. But again, it is worthwhile in this little bit of breathing room that you have before it reaches peak in South Dakota to kind of sit down and think through your stakeholder groups and how you'll communicate with them. Business continuity. This is one of those things where we could do a whole webinar on this, and in fact, there's an entire discipline built up around the concept of business continuity. Here, as a leader, here's the thing that I want you to recognize. I see there being two different types of business continuity planning. The first one is tactical continuity. That means you're thinking about what happens tomorrow, what happens next week, what happens 2 weeks from now. It's a very short planning horizon. And what you're doing as part of that planning is to prioritize critical functions and determine staffing and resource requirements. To do that type of planning, it's really important for you to engage staff, vendors, the South Dakota Department of Health, patient and families. You're really just trying to figure out how are we going to get through, based on what we know right now, how are we going to get through, the next hours, weeks, or days. And then there's something longer term that I call strategic continuity. That is, what are we going to do a month from now? What's our business going to be like 6 months from now, 1 year? You're really focused on business recovery and or how you modify, rethink, or shift your business model to accommodate the new normal that we're probably going to be seeing as we move through and come out of this COVID-19 pandemic. To do that, the best people to engage are your parent company, financial advisors, insurance advisors, community leaders, industry peers, and of course, as you're doing both types of planning, you need to keep on maintaining situational awareness and adapting those plans accordingly. And last but certainly not least, as part of this framework, the other big area of leadership where you need to constantly be paying attention is team care. Unfortunately, we have all seen, and I know you've seen it firsthand, the toll that COVID-19 has taken on hospital staff and the staff of long-term care facilities. Stress, physical fatigue, vulnerability to the disease itself. These are all things that make this one of the hardest jobs in the world right now. And we also know that it can take a devastating toll. Just earlier this week, I believe there was an ER physician in New York that committed suicide when they went on break after an extended work in the ER. So what do you do with that? As a team leader, you can't ignore that piece of the job. You have to be sure that staff are being provided with tools and protection for self-care. You also need to acknowledge the risks and stress. You can't pretend this is not a threat. You also can't assume that you understand exactly how that risk appears to the other person. And again, we'll talk about that a little bit in the webinar next week on communication, but risk is very personal and everybody interprets it differently. So what do you do? One of the things that you can do is consider designating a team care coordinator, somebody who is really looking out across the team and making sure that people are taking care of themselves, that they're not overworking, even though we're in a situation where a lot of people have to push pretty hard. They should also have the authority and also the empathy to be able to approach people who are clearly not making good decisions or not performing well because they're tired or overwhelmed, talk those people through it, even ask them to stand down if necessary. The other thing about team care, I would say, is that necessity is the mother of invention. We've seen this over and over again. People have been very creative in figuring out how to address specific needs or mitigate risks. For example, it's everything from hospitals converting operating rooms to ICUs to nurses developing headbands that they can put over their ears with buttons on them so they can, hook their masks on so their ears won't get rubbed. So be on the lookout for innovation and creativity among your staff. People will adapt and come up with things to reduce risks. And if you see a good idea, deploy it across the organization. This is not a time to get stuck to your policy about who wears what or how who can float ideas or having multiple things approved. If something's working and there's no downside to it, deploy it. The last thing I would say on this is team care applies to you as well. And as a leader, you should know that if you're tired and overwhelmed, your ability to make good decisions and synthesize information quickly and adapt will drop. So you also need somebody who's willing to say to you, you're tired, get some rest, come back tomorrow fresh. And you also need a backup. Everybody in your organization needs to have a backup. So with that, I'm going to hand this back over to Mary Ann to wrap up for us.
Thank you. Before we close and take some questions, I'd like to add that in spite of the uncertainty surrounding the COVID-19 crisis and the heightened levels of flexibility and adaptability that are demanded of everyone right now, there are some things you can control. You can control how you react to this moment in time and set an example for others within your organization. These are the kinds of actions that actually can affect your organization's reputation in the long term. So some questions to ask yourself as you plan and act during this unprecedented time are: one, what level of care and service do my stakeholders expect? You already have a reputation in the marketplace and in your communities. Be especially self-aware right now. Consider how others will react to the actions you take, and make sure you're living up to your company's reputation. And if your company's reputation is a little bit short of where you'd want to be, this is a good time to step up and shine. What are you doing for the community? Of course, this isn't the time with resources stretched so thin to launch new programs or initiatives, but think of how your organization is strengthening the community in this difficult time. Even if it's simply sharing insights or information with a partner you have in the community, or showing appreciation for the meals that people are donating to your frontline staff by posting a thank you photo on your Facebook page. Small things like that matter at times like this. What are the priorities right now? Polly talked about a leadership challenge a moment ago and said every day ensure you are addressing the situation as it is now. I think you need to remind yourself of this often, maybe every day, maybe stick that message on your computer to just remind yourself to focus on what is happening in the moment right now that I can address. And then finally, how do you want to be remembered as a leader? I think I don't need to explain this much further than that, but as Polly said earlier, this is a time that does require some soul searching from our leaders, and especially our leaders in healthcare. So thank you. We are going to take some questions here in a moment, but we invite you to stay in touch with Polly and me. Michelle will be sharing our information, but here it is just in case you missed that. And now we are going to take some questions. I believe Michelle will be facilitating the Q&A portion of the webinar.
Yes, that's correct. Thank you, Polly and Marianne. Terrific information and great reminders on how to lead our staff. So at this time, like they mentioned, we will be taking questions in the chat feature in Zoom. So we really want to be able to utilize this time to ask any questions for Marianne or Polly. So if you have anything, please feel free to type that in or unmute yourself, and you can ask them directly. So with that, ladies, we do have one question here, and it states, what should a leader do if staff members are resistant to the facility's new normal? For example, if a staff member isn't following safety protocols and repeatedly goes outside the chain of command or refuses to take on a new role or responsibility.
Marianne, you want to start?
Yeah, sure. Well, one obvious thing that should be done is to reiterate what the downstream or downline implications are of not following those procedures or not participating as a team member and doing things the way a response team is outlined or standards they've set for this moment in time. And thinking about what those downline or downstream implications are is something that you might want to incorporate into a scenario planning exercise or some kind of planning exercise. What are those implications of not doing something a certain way? Polly, do you want to add anything to that?
Yeah, I know. I think that's good. And then also, one of the challenges here, we've talked a lot about adaptability and creating an environment where people have enough guidance to make the right decisions in the moment. They don't have to wait for somebody higher up in the chain of command to direct them or make a decision. The whole idea of having a response team is not to hamstring everybody so they can't make decisions. But when you do that, you do open up the opportunity for people to kind of go rogue. And I think as a leader, one of the things that you have to do is be very clear about which things are non-negotiable and what the what happens if you don't follow the rules. And I would say that one of the non-negotiables is, for example, personal protective equipment. What you wear and when and how you wear it, that has to be set up as a very clear rule, and the implications have to be communicated to staff. But above and beyond that, I think if somebody does go out of their way to do something or different creative, that's when you need to show up and check in with them and figure out what's going on. Occasionally, under normal times, we see people doing that, and it's because of politics. They either don't want to participate in the response in that way, or they want to continue to lead the way they've always led, and it's a way of sort of minimizing what's going on. I would say that based on everything I've seen, in general, people are jumping in and doing the right thing. But if you do have somebody who seems to be going off script, you need to pull them aside and have a conversation with them about that, and acknowledge if there's something good or positive about what they're doing, acknowledge that, but also make sure they understand what the lines are.
Fantastic, thank you. The next question that we have here is related to rural health and some of our rural sites, and it states, all signs indicated COVID-19 will be with us for a while. How can a smaller facility or health system in a rural area and with limited staff sustain its response?
Well, you know, did you want to jump in, Polly?
Yeah, I just wanted to say something first, and I think that's one of the big challenges. You know, one of the things that we just showed you was the two different models of response teams, and big multi-facility companies face specific challenges, and smaller companies do. Big companies are complex, and they have a large number of people that they're having to manage and deal with. Small organizations have limited resources and fewer people, but they can be a little more nimble because they're smaller and less complex. But it is a challenge when you have a small group of frontline staff and then a response team. Everybody's going to get tired and everybody get worn out, so what do you do? And I think it's having to look beyond your walls to additional resources. Marianne?
Yeah, I was just going to really add on to that. This is a time when a lot of boundaries are torn down in terms of trying to help and share information. So it's a good time to tap into a lot of resources that others are making widely available, whether it's at the government level. There's certainly quite a bit there, but even in the local level, within the business community, within your professional associations and organizations, there is a lot of information. I've been tracking a lot of this for a while for other clients, and I'm continually just impressed by the amount of information that people want to put out to help others who are trying to get through this. So I would say, especially for under-resourced organizations or facilities, tap into what's available in your community, within your professional associations. There is a lot out there that can be useful, and you don't have to reinvent the wheel.
Great, thank you, ladies. All right, with that, I would just like to say thank you to both Polly and Marianne for this incredible webinar today. And I will be resending out the slides along with the recording just to make sure that you have that information. And I know both the ladies would be more than happy to answer any questions that you may have after this as well. And I'll make sure that their contact information is included. And I'd just like to say thank you again to Ready Inc. and then also LMC for sponsoring this webinar. I hope you all have a great day. Thank you so much.
Thank you.
Thank you.